This is John Geaver for MedPage Today at the American College of Chest Physicians meeting in Philadelphia. Dr. Danai Khemasuwan of Albert Einstein Medical Center here has reported a potentially very important finding with regard to statin drugs and venous thromboembolism.
Statin, as we know, this is a medication that commonly used in the patient with their heart attack and stroke and peripheral vascular disease. However, there's minimal evidence about using of statin in the patient who had DVT and PE. So we conducted observational studies, chart review around 200 cancer patients, and I exclude the patient around 450 to have a prior anticoagulation therapy with the coumadin or intravenous heparin. And in total, the patient of 740 patients, including to the statins. And I divide the patient into two groups, between statin user and non-statin user group. Around 200 patients on statin and around 550 not use statin. I found that in the statin user group, around 60 patients or 8% developed their PE or DVT. And in the non-statin user group, around 116 or 21% developed their PE and DVT. So I used their statistical analysis to find the relationships between the cause and effect. I found that the statin decreased the risk of the PE and DVT in the cancer patient. However, this is observational studies. There's possible confounding factors. Some of the patient has metastatic disease, have a record about immobilization, current use of chemotherapy, smoking, and use of aspirin. So I include all these possible confounding factors into their further analysis. So even that, including all possible confounding factors that I already mentioned, statins still statistically significantly decrease the risk of developing the DVT or PE in cancer patient. So, however, this is again is observational studies. There's many possible confounding factors and bias. So for the next step that we need to do to conduct the experimental studies or we call the prospective studies, including the other possible confounding factors that I not mentioned about the BMI, which is one pretty significant. And also we can measure the serum lipid levels. So at this point, I cannot explain that the finding that I found that statin decrease incidence of PNDVT cancer patient, is that related to the lipid lowering effects, or it's just anti-inflammatory or anti-sclerotic, anti-thrombotic effect of the statin. So we need more further study to conclude the data.
The next step, according to Dr. Khemasuwan, is a prospective trial to confirm the results. I'm John Geaver, MedPage Today.